I'm Manish from Team Aegis, and this is our project Medbase. We have focused on the following SDG goals, that is good health and well-being, quality education, industry innovation infrastructure, as well as reduce inequalities. This over here is our team, that is P. Satvik, who has worked on our UI and UX designing, Sai Vardhan, who has worked on the front-end developing of our website, as well as Sai Venkat, who has worked on the back-end developing as well as the architecture. Before we start on to our problem statement, I'd like to start with something we've all probably experienced in our lives. At some point, we've all searched our symptoms on Google. It could be something like a headache, a cough, a random pain, or a stomach ache. And almost every time, the results go from something harmless to something extremely serious. For example, cancer. I still remember the day where, when I was young, I searched about I had a headache, so I just went and searched in Google that I have a headache. What symptoms or disease do I have? And the first result I saw was cancer. Interestingly enough, then this brings up a very important question. That is, health is the most important aspect of our lives, but there is no proper website or no proper source where we can actually see about all the latest information regarding the medical breakthroughs or regarding the medical news, the information regarding all sorts of diseases, its causes, prevention, treatment, and etc. etc. So, according to the problem statement, we have medical information everywhere. We are in the age of Internet of Things. We have everything in Internet. Yet, we do not have a specific web page or a website or a database related to medical industry. Why is it so? And this is actually much more important people realize too. For example, during COVID-19 symptoms were there was three levels of it: normal, medium, and severe. And whereas in normal cases everyone had a flu, it was because of a flu. So we just started coughing and all. It was some people had normal cough, some people were coughing due to COVID-19. There was a difference between the two. But since it was during COVID-19 and when people searched in Google and our beautiful WhatsApp messages with very very interesting symptoms and treatment procedures, the results were very devastating, to be honest. Everyone thought they had COVID-19 just because of a normal cough. They googled it, they just showed COVID-19 for literally everything, and then WhatsApp didn't make it any better. In fact, I feel like it made it even worse for the society. And so, information like this can be prevented by having a understanding on what exactly we are facing or what exactly is our issue over here. And that is exactly our solution or our introduction. This, for example, like I said in the COVID-19 case, a small symptom, yeah, actually is a big question. But like I said, on during like this COVID-19, or even you can take for example something like a headache. Normally, people when we search for a headache, we get something like brain tumor. Sometimes it is probably just a lack of sleep or due to stress or something. And for example, even let's just take brain tumor, there are even more number of causes or symptoms and details list is there. Based on that, you can actually tell, like for example, symptoms whether you have it or not, should you get it checked or not, and etc. This is an issue that many people face, and that is exactly what we want to solve. Medbase wants to close this gap by providing verified, easy to understand health based information. This information is from trusted medical sources. For example, we have used WHO, we have used sources from Medline Plus, which is a famous um, medical website in US. We have used data from government of UK, we have used data from government of India, we have also used TGA for drug purposes and etc. This is a research survey we have conducted. Like we said, search engines provide as relevance and not medical context. For example, sometimes you go to some website and the terms are too technical for us normal general public to understand what exactly the issue is. That can be only be understood by relevant industrial professionals or medical professionals who are in that field. Only they can understand, for example, something related to cardio or something related to brain, something related to cancer or something related to lungs. That can only be understood by those professionals who know those technical terms. We have no idea about it. And government portals are fragmented and very hard to navigate. This is extremely true. For example, let's just say you go ahead and visit your own government's portal and website. It feels too compact, like too much at once. You see, you know it's government, otherwise you feel like, okay, there is a lot, but where to search, what to search, and the information is too much at a time for us to actually process and understand a very easy two-way manner. And that is exactly what we are trying to solve. Like we said, this is our solution. We, like I've said before, are using only medical sources from government official website or on classes like WHO. For example, one such as ICMR, NHS, National Health One, Government of India, Government of UK. We are also planning on using Government of Australia as the medication is very good, also Switzerland. So we are planning to use all of this. And Medbase presents clear explanations. For example, let us say you have something like a fever. What are the symptoms of fever? What are its causes? How can it be prevented? What are the schemes available in your nation or in your government that can be used for it? For example, let's just say there are a few schemes like Bharat Yojana scheme where you can actually gain a so and so amount of stipend or a so and so amount of funding for whatever issue or based on your circumstances. Medbase provides all of this in one integrated fashion. This over here is a basic working prototype which we have made so far. There's not a lot we have done in this. We have just developed the UI UX and the front end designing for now. Later on we'll be integrating even more back end APIs and an AI chat for non-diagnostic purpose. I want to make this point clear. This is purely for information relevant, and you can say it's like a medical encyclopedia. We are not planning on using this for diagnosis or anything. This is just so that people can know what it is and they can use it to prevent whatever is happening. This is our UI UX one, and this is the basic prototype for it. For example, we have some quick health topics like diabetes, heart health, dengue, tuberculosis, malaria, and these are some common health conditions like diabetes mellitus, one of the leading diseases in the world, hypertension, COVID-19, which I discussed before, tuberculosis, and etc. We have integrated a voice command as well. For example, let's just say I say COVID-19. And there you go. You have COVID-19. It's an infectious virus. We'll be going more and more depth into this, and we'll also try to make it more and more simpler as we develop our website, so and so. And its causes. These are the risk factors for it. These are the prevention that could be done for. We can get it vaccinated, wear mask. And as we develop this website further, we'll also provide what type of vaccines are recommended by the sources, what type of mask should be used, and all. These are the standard treatment procedures, and these are the sources from where we have taken this information so far. And this is not only for disease search command. You can also search any type of diseases here. That over here is a disease search one. You can go for metabolic or cardiovascular diseases or something related to your eye diseases as well. Like I said, this is an extensive project which you're going to work even more on and actually add a lot more details, and we'll make sure that it's completely simple. It is understood by general public especially. And these are the healthcare related schemes which I've said so far. For example, I let this is based on a regional providence. For example, I give it my location. It's going to track my location and tell me what are the available schemes in my state level area or my regional level area. These are the national health scheme like Ayushman Bharat, which I said around 5 lakh per family per year. And these are a few schemes available in India. This is one such scheme that's available in Telangana. You can go to some other state by manual selection, let's just say you're somewhere in like Andhra Pradesh or something, or let's just say you're in Andhra Pradesh for now. So if you go to Andhra Pradesh, delete my location, and then you go here, you have some link like Dr. YRS Arogya Swami Healthcare Trust. Many things are available. Even more schemes are available. We'll be like adding all the data in the back end integration of it as well. And this over here is an about us section which will be improving even further and further as well. And this is one point I want to make extremely clear, is that we only provide education. We are not diagnosing any symptoms whatsoever. This is just so that people can have an idea, because as the saying goes, better be safe than sorry. If you have knowledge about what you're experiencing or terminology, you can leave about common health diseases, but there are some rare diseases that people generally do not have any idea of, and they come out pretty late. Their symptoms are obvious, but because we lack an understanding of it, it becomes a major issue. So those all can be avoided as well. And these are the advantages of it. Like we have said before, it provides early awareness and preventive action, reduces anxiety and misinformation, provides clear and structural data, uses region specific government healthcare schemes, and encourages us to take responsible health decisions. The disadvantages are we do not replace any doctors or hospitals, it's just an encyclopedia. Coverage is limited because of high impact diseases and all. We'll be adding them more and more and more, like as we develop it further. We require expert review. We need to keep on updating based on the latest updates of each and every disease, and the access is limited to internet and basic digital literacy, which we plan on focusing at least to turning the data into regional specific languages as well as running it only on cache memory. And this is the conclusion. The conclusion is that we want to let people take the decisions for themselves. Like when I say decision for themselves, to let them gain the knowledge of what disease they're having so they can go and consult doctors or they can have an understanding of what's exactly happening to them. We are not diagnosing any symptoms. We are giving an idea of, oh, this could be a possibility. Go check it. Like if it's there, it's good. But let's just say you're coughing. You thought it's a normal cough, but because a few symptoms were similar to cancer symptoms, you went and got it checked. It was early stage cancer, you got it cured. Excellent. But let's just say you ignored it and it went to last stage. Just a simple checkup could have avoided you. That is our plan. We plan to educate people. We plan to make sure the medical industry is well known to public. It can also be used by students who are working. They can also know about more and more diseases because they have all sorts of diseases in one place altogether as well. Thank you.